This is Brian from Red Deer. He has just been diagnosed with type 2 diabetes. This is due to many different factors.
Type 2 diabetes is a milder form of diabetes that develops most often in older adults. In type 2 diabetes, your body may not be producing enough insulin or using it properly. It is caused by a combination of genetic factors related to impaired insulin secretion, insulin resistance, and environmental factors such as obesity and lack of exercise. Homeostasis is the body's ability to maintain a relatively stable internal condition. A good example of hormonal negative feedback is the control of blood sugar, or glucose, by insulin. Normally after a meal, the blood sugar rises, receptors in the body sense these changes, and the pancreas, the control center, secretes insulin into the blood. This change forces body cells to absorb more glucose, removing it from the bloodstream. It also stimulates the liver to convert glucose to glycogen. As blood sugar falls, the stimulus for insulin release ends, and the body can then return to homeostasis. Normally, in a healthy person's response to high levels of blood sugar, the pancreas secretes insulin. Insulin is a small protein produced by the beta cells in the pancreas that consists of two amino acid chains linked by disulfide bonds. Its main function is to lower blood glucose levels, but it also influences fat metabolism and proteins. Insulin then binds to the insulin receptor cells that are embedded in the cell membrane. This signals the glucose transporter number 4, which is the insulin-regulated glucose transporter. The GLUT4 is then sequestered in intracellular vesicles. After the signal is received, GLUT4 goes into the cell membrane and becomes available for transportation of glucose. GLUT4 then brings glucose into the cell to be used as energy. In someone with type 2 diabetes, they may have impaired insulin secretion. This is a decrease in glucose responsiveness. The pancreas secretes an insufficient amount of insulin. Therefore, not enough insulin goes into the insulin receptors, and the GLUT4 protein does not receive the signal to enter the cell membrane and bring glucose into the cell. When untreated, there can be a decrease in pancreatic B cells. Impairment of B cell function greatly affects long-term control of blood glucose. Someone with type 2 diabetes can also have insulin resistance. This is a condition where insulin in the body does not exert sufficient action proportional to its blood concentration. Since cells are resistant, no message is sent to the GLUT4 protein, and it stays inside the cell, and glucose levels remain high, and the pancreas produces even more insulin. Eventually, pancreatic cells become exhausted, and it produces less insulin. Both insulin resistance and impaired insulin secretion can happen separately or simultaneously in someone with type 2 diabetes. A quick reminder with insulin resistance and impaired insulin secretion is that in type 2 diabetes, insulin resistance is more common and happens before impaired insulin secretion. The insulin becomes impaired as the beta cells are exhausted from producing so much insulin for the resistant cells. As stated before, the pancreas plays an important role in insulin production. The pancreas consists of two major populations of hormone-producing cells: the glucagon-producing alpha A or A cells, and the more numerous insulin-synthesizing beta or B cells. In type 2 diabetes, beta cell dysfunction can occur. It is caused by many factors, including the initial decrease in beta cell mass that is related to genetic or prenatal factors. Beta cell exhaustion due to insulin resistance and lipotoxicity, which is toxic effects of lipids on beta cells, can also occur.
In review, normally in the body, when blood glucose levels increase, the body responds by producing insulin, and responding to the insulin with GLUT4 receptors and using glucose in the cell. Proteins are important in this process, as insulin and insulin receptors and GLUT4 are proteins. In type 2 diabetes, cells can become resistant to insulin and/or there can be impaired insulin secretion, as well as a decrease in the number of receptors for insulin, and causing an increase in thirst and urination from the high levels of glucose. The cell membrane is an important part, as the GLUT4 and insulin receptors are in the cell membrane. As seen in Brian's case, his type 2 diabetes is caused by obesity and a diet with too much rapidly digested glucose and fructose and genetic factors. Type 2 diabetes is a preventable disease that can be cured if caught early.